Thank you, Madam Chair. Democracy at work, right? Acting Commissioner, I was born in a safety net hospital. I represent 4 safety net hospitals in the heart of central Brooklyn, serving predominantly Black and brown patients. And in this budget, the governor has given our safety net hospitals nothing. Historically, our safety net hospitals struggle. They serve the neediest patients. We don't have a commercial insured pool. It's a Medicaid insured pool. They are struggling with their finances, and the state, on a perennial basis, simply offers them one-time shots. My only question is, what are we doing for our safety net hospitals? Why is there nothing in the budget for them? We need structural reform, not a one-time shot. And I'm curious as to why we have to make this case every single year, whereas hospitals and other institutions in predominantly white and more affluent neighborhoods don't have to make that case.
Yeah, so safety net hospitals are very important to the governor and to myself and the Department of Health, and agree with you that we need our safety net hospitals. There's no debating that. I think there actually is quite a bit in the budget for safety net hospitals, though. Let me walk through a couple of those points, and then I'll go to Medicaid Director Myrie to hit some of those points as well. But we did do the statewide 3 awards. In fact, $200 million just went out Monday. We have $1.6 billion in statewide 4 that's coming out this year as well. There's another $1 billion coming in statewide 5. I do think there's other things here as well. For rural hospitals, which are affected by this as well. We do have the direct payment templates, which is about $1 billion. We have the VAPAP program and Vital Access Provider Grants. The 5% increase in Medicaid is the largest increase we've had in 20 years. And I think there's other things as well, quite frankly, we need to do to help reduce costs for hospitals. One of the things I've heard from every hospital station is they need to be able to predict costs, and staffing is a big issue for them. So I think there's some things we're doing with for nursing staffing, in other words, traveling nursing, to help control costs, to get some transparency in that space. We're doing some things for certificate of need reform, which will help some hospitals as well. And I think we're going to do some things with scope of practice as well. Scope of practice, to me, there's some modest changes in this budget that I think will help all the hospitals, including safety net hospitals. And just to be clear, there has been a 286% increase, in funding of hospitals, safety net hospitals, since FY20. The $700 million from last year was a one-time deal, and I'm sorry I used up all the time.